really this is all about leadership at the beginning, and that's why I'm sure that both in Suresh's and Jeff's departments, the incidence of burnout is relatively low, because you can get a sense of strong leadership. And leadership is really what creates a culture of wellness. So at Stanford, we're very fortunate to have Tate Shanafelt, but we had a very strong wellness program I've been lucky enough to be a part of for the last 5 years. We have many programs to help de-stress our faculty members, and I think sometimes just knowing that those programs are there is salient. Like people who like to live in a big city with lots of culture, even if they never go to the opera, somehow it's rewarding and satisfying being in that culture, and that really comes from leadership from the top. So I think Suresh and Jeff have done wonders in their departments. The next component of creating wellness in a department is practice efficiency, because no matter how happy we are, how resilient we are, what great leadership we have, if we're stuck in the hospital for an hour and a half every night after we finish our cases because we can't figure out how to sign our charts, and we don't have any support for the electronic medical record, or if we work in a clinic and there's not enough clinic space and therefore the patients are backed up and we have to stay late and the patients are not happy and our Press-Ganey scores go down, we're not going to be very well in our department. So we need leadership to establish a culture of wellness. We need practice efficiencies, and we need personal resilience. So it's really a trifecta. I have no relevant disclosures for this talk. So this is the rubric at Stanford, and you can see that it's really a three-pronged approach to creating wellness in our departments: creating a culture, committing resources to improving practice efficiency, and having resources that help facilitate personal resilience, and that's really where I come into play. These things cost money, so Dr. Shanafelt has a significant FTE devoted to the WellMD program at Stanford. He has a staff. We have a nutritionist. We have an exercise physiologist. So it takes resources in order to create these programs of wellness. Practice efficiency, I've got Ellen Wong in my department in pediatric anesthesia at Packard Childrens Hospital at Stanford on speed dial. So whenever I hit a wall with Epic, Ellen, yeah, it's Greg again. Okay, yeah, she pulls up on her screen what I'm looking at, and she helps me solve the problem quickly. But again, she has a percentage of her FTE, and she was recruited partly for expertise in that area. So no matter how personally resilient we do rely on our departments and our institutions to commit resources. And I think now that we've spent several years talking about these problems, defining the problems, I'm happy to see that we're starting to discuss the solutions, and that's what I would like to do. The administrators are big on quality and metrics. So we talk about improved patient care and lowering costs, getting better outcomes. What has been missing until now is physician wellness. I really think that needs to be the fourth quartile in this pie that until now has really been ignored, but I think it is beginning to become a priority in our departments. So I'm going to talk about personal resilience, and my personal resilience rubric is based on my own meditation practice for many years, which has evolved into this simple acronym called GAIN. It's not on this slide, but GAIN includes gratitude, acceptance, intention, and non-judgment. So for example, I'm grateful to all of you for being here today. I'm grateful to Jeff and Suresh for speaking. Acceptance, we need to be able to recognize the things that we can change, decide which of them to which we want to devote our resources. We also need to discern what we cannot change. And I think this is a fundamental component of most religions and philosophies, AA, et cetera, is that we have the wisdom to discern between what we can change and what we can't. So we all have many people in our departments and our groups who are constantly complaining about the way things are, and I think we need to start focusing on the things that we can organize ourselves and change and accept the other things, at least for the present time. So acceptance is key, and I accept the fact that Jeff was blaming me on the slide presentation when in fact I had nothing to do with it. So I relegated it to these wonderful guys in the back, and thank you for that, Jeff. Intention. We're not just to be led around on a leash. we need to recognize the power that we have to change the way we think. So we can focus on what is our intention. My intention is to finish the session on time, leave a bit of time for questions and answers, and have everybody walk out of this room happy and satisfied and at peace. The N in GAIN is non-judgment. We are very judgmental creatures, especially the male species. Male of the species is very visual. So we see things and immediately we put all these judgments on. Everything seems to have to be good or bad. And I think we need to focus our attention on that and begin to really get past these continual judgments that we make, because they're not really healthy for us. So the tripod on which this GAIN or presence practice, as I call it, really stands, the foundation has to do with taking care of ourselves first. And that's why I really appreciate what Jeff said about it's not the patient comes first, it's the faculty and the residents and the staff who come first, because if they're not highly functional and happy, the patients are not going to get good care. And that's been shown. There are lots of data. In a separate talk I would be happy to share, or in fact, if anybody wants to send me an email, I'd be happy to send a set of slides on this wellness topic in a broader context. My email address is ham, H-A-M, my personality, H-A-M, @stanford.edu. But there are lots of data now about the costs of burnout, and in particular, bad patient outcomes result from burnout. I don't know whether it's just that we're not washing our hands and being careful, but we know that. So we have to take care of ourselves first and help our colleagues first. So I think nutrition, exercise, and sleep are key. I have a degree in nutrition. When I'm in the ICU, I teach my trainees about nutrition in the intensive care unit because it seems like they're not taught about that anymore. But we need to know something about our own nutrition. But even with my degree, I'm confused. Should I be eating low fat, low carb, high protein, high carb, low fat, medium protein, low everything, high everything, or maybe just fast? Exercise, cardio has been big. We had the aerobics revolution in the 80s, but we're focusing too on resistance training now for keeping our bones and soft tissues healthy. And then sleep, of course, we all need 8 hours of sleep a night. So I think, okay, well, I'm gonna stop there. And no, obviously we know something about the importance of sleep, exercise, and nutrition, but we need to really focus on ourselves and taking care of ourselves. I think as physicians, we tend to focus on our patients. We're pleasers, we're nurturers, we're healers, but we really need to turn toward ourselves and heal ourselves too. So we talk about sleep, exercise, and nutrition, and I really think the fourth main ingredient for self-care is mindfulness. How many of you have taken a mindfulness-based stress reduction course? So that's great, because that's a lot more than when we did this last year. Mindfulness, according to Jon Kabat-Zinn, who's really the founder of mindfulness practice in the US, if you will, back from the 70s, is awareness that arises through paying attention on purpose, in the present moment, non-judgmentally. So the keys here are paying attention, and I think our intention comes from paying attention. On purpose, again, intention, in the present moment, without judgment. And these are very simple principles. We need to go back to those principles. So mindfulness is non-judgment, awareness on our experience as it is happening, being present. So if being present is happiness, why are we not more present? I think we all recognize that when we're truly happy, it's because we're in the present moment. When we're unhappy, it's because we're in the past and the future. And I'm a key example. I tend to dwell on things I'm ashamed of, things I should have done better. If I have a bad patient outcome, I focus on what I could have done differently. If I'd done something differently 5 minutes before, the patient might have survived. And that's what I think about. I don't think about the lives I may have saved. I'm sure there have been a few, but I think about the shame and the remorse. When I'm in the future, I'm thinking about what might happen next, worst case scenario. We're trained to do that. And that's where fear and anxiety come into play. True happiness is in the present moment. So we need to think about the past, to learn from our mistakes, and to savor our memories. And we need to think about the future to put food on the table and plan for retirement and other things. But most of the time when we're thinking about the past and the future, it's maladaptive. And we need to bring it back to the present moment. I think that's one great thing about humor is right before that punchline comes, you are right there in that present moment. So if it's a good storyteller and it's a good joke, they've got you just before the punchline. And you think about that, you're focused right there. You're just right in that moment. And then there's laughter, and if it's a good joke, everybody's laughing, and again, present. The newborn baby is the model of presence. When we're born, we have no sense of time, past, future, no sense of place, me, not me. We don't see where our hand ends and our mother's body begins. We are perfectly present. By the time we're teenagers, we're full of shame, fear, and anxiety. So what happened? How did we get there? Well, actually, can I go back one slide? We need, as we develop, and my research is in the area of developmental pharmacology and immunology, so I'm very focused on what happens from the newborn period to infancy, to being a toddler, school-age child, and adolescent. So I think of how our minds develop and why it is that we're not more present. We need to develop a sense of separation in order to be weaned, in order to learn, these are my toys, those are not my toys. We need to start learning from our mistakes, since we're on a very steep learning curve when we're school-age children. By the time we're adolescents, we're comparing ourselves to everybody. We're feeling shame. We made mistakes. We said things we wish we could have taken back. We're comparing ourselves to our friends who are taller, better looking, better athletes, going to get into better schools. We're anxious about the future, getting into a good college. Will we be successful? Will we measure up? So we have this developmental process from the newborn period to adolescence and adulthood where we're increasingly focused on the past and the future. And by the time we're young adults, this is how we think. Our minds are just full of concerns about the past and the future, and we have a much harder time being present. A good example for us, and I think we're prime examples of a lot of these issues about dwelling on the past and the future and failing to be present, is multitasking, because it's part of our job. So we're always on the lookout, we're being wary, we're waiting for the other shoe to drop, we're waiting for something bad to happen, and we have to multitask in order to get a good outcome. So next time you find yourself multitasking, I'm going to ask you to think of this simple little exercise. This can be a thought experiment, or you can go home and do this with a piece of paper and a pen. Write down, I am a great multitasker. And then separately below that, write down the numbers 1 through 15. And see how long it takes you to do that, without rushing, but efficiently writing, I'm a great multitasker, and then number 1, 2, 3, up to 15. And then, just as Jeff said, so now put the other thumb in front. So now I want to have you approach that simple exercise differently and alternate between writing down a letter, and I'm a great multitasker, and writing down a number. I1, A2, M3, etc. Until you've written again, I'm a great multitasker, and the numbers 1 through 15. See how long that takes you. It takes you a lot longer. So this thing about multitasking, which my kids grew up with, and I'm sure many of you have kids in their generation who grew up with computers, they would be sitting in front of the computer and have a little instant messaging window open and some other kind of chat going on here, their email over here, their homework might have been like in the lower right-hand corner. And they thought they were smart for doing all those things, and that's kind of been indoctrinated in our culture. And I'm glad to see we seem to be coming full circle, and now that there's some data showing that we don't really learn very well when we're multitasking. But again, this multitasking takes us away from our present experience. So it's another factor in our culture that really does that. So we talk about the foundation of self-care, nutrition, exercise, and sleep, and what I call presence practice. It's basically mindfulness, but I just couch it a little bit differently. For me, my mind is already full enough, so I don't want to put anything else in there, and that mindfulness term sort of rubs me the wrong way. What we really want to do is learn how to become present again. Again, bringing our attention to the experiences occurring in the moment we're actually experiencing right now. And this applies to our personal life, family life, exercising, and certainly our work. If we can really focus on what's going on right now, yes, it's adaptive to think about what happened a few minutes ago when we gave a drug and the blood pressure bottomed out. Yes, it's adaptive to think a little bit about what's coming next in the surgical procedure and what we can do to prevent a mishap. But beyond that, our obsession with the past and future is maladaptive. So let's do it adaptively and not maladaptively, and enjoy the experience of being right here with this wonderful team in the operating room, patients having a good surgery and a good anesthetic and excellent nursing care. So this is the way we would not conduct our anesthetic practice, that is multitasking. So what we would not do is set up the machine, drop a drug, check the monitors, drop another drug, check the pressure in the breathing circuit, check our airway equipment. We need to be methodical to try to do each thing in the present moment. How do we learn to be present? Well, we have to set our intention on it because, as I said, developmentally, we've got all these really bad habits about dwelling on the past and the future till we're obsessed with mistakes we've made and fear and anxiety about what comes next. So we need to exercise our presence muscles, if you will. We can do this, though. So I'm going to talk a little bit about the importance of gratitude, acceptance, intention, and non-judgment. Takes practice. I think we learn by doing small steps and doing them repeatedly. So how many of you have tried meditation? How many of you regularly meditate? A lot fewer, but some. And I think the reason is there's this expectation that you should be able to sit quietly in the lotus position or, take your right ankle and put it behind your left ear and sit quietly without moving and have no thoughts going on in your head. And to me, that is completely incorrect. I think you should sit comfortably, accept the thoughts that you may have in your head, and start with small bites. So when I teach meditation to the trainees, I teach them a 3-minute meditation, which is based on this GAIN rubric. So if they're getting up at 5, I ask them what time they're getting up, say 5:30. The night before, I want you to set your alarm for 5:27, because you're going to do a 3-minute meditation in the morning. They can't tell me they don't have time to do that. So it gets their intention started the night before, and then in the morning, they're prepared, they've already carved out 3 minutes. So let's talk about gratitude. We forget for how much we have to be grateful. I mean, we're all here learning from each other, sitting in this room together at this wonderful conference in this beautiful city. And, if our room is not quite right, then we're obsessing on complaining about it. But we all have so much for which to be grateful compared to having been born in another place much less fortunate. So I think we need to remind ourselves on purpose, right now, how grateful we are. So we walk past the couple of people having a conversation in the operating room, complaining about the turnover time or the schedule or an add-on or what have you. Stop and with a pleasantry, perhaps bring some gratitude to the equation. At least if we have this going on in our own minds, we can focus on how fortunate we are to be physicians, to have the privilege of taking care of our patients, to be here in this hospital where generally people are rowing in the same direction. We have a lot for which to be grateful. Someone tells you, my left knee hurts, focus on your right knee. Your right knee is great. Be grateful. Acceptance. Again, it's all about discerning what you can change and what you can't change. It's so counterproductive to focus on things you can't change. So the surgery schedule is what it is. To the extent that you might be able to call your next patient in early or what have you, you might put a little energy into calling the front desk and you're going to have a gap. The case you're doing now is scheduled for longer than the surgeon's going to need. Get the patient in early. So there are things that you can do something about. Focus on those. The things that you cannot change, you have to accept. And if you resist everything you can't change, you're going to have increased suffering. So I don't know if the slide made it. Yes. So this is a nice equation. It's the only one I'm going to show. Just occurs to me that suffering is pain times resistance. So you have something painful. I had a cancer diagnosis. I had to accept it. But once I accepted it and lowered my resistance to it, The pain was still there, but the suffering was greatly diminished. Turns out, just by the way, that there's a miracle immunotherapy drug. I take one pill every morning and I'm fine. So that's the start of my gratitude practice every morning for my 3-minute meditation or 15-minute meditation. But for all those things that are painful to us, we may not be able to change them. You have a child who's ill, who's got a chronic illness, or a spouse, or yourself. Accept it. Learn to kind of bring that pain in until it's really part of you. Ingest it. Open your heart to it. Don't resist it. And when the resistance drops, the suffering will drop, even if the painful issue is still at hand. Intention. So we can do things on purpose, as John Kabat-Zinn said. We've got our brains wired according to this developmental momentum from being totally present to being obsessed with the past and the future. But we can change that. We can rewire our brains if we put our minds to it. How many of you have heard of the 3 Good Things study at Duke? A few. So you can actually go on their website and search it, and you can join the study. You take a baseline quality of life survey, and then you start the practice. Here's the practice. Every night before you go to bed, think of 3 good things that happened during the day. That's it. You'll find that you sleep better, you wake up a little bit better rested. When you do this, again, small bites, but every day, it becomes part of your routine at night, after your hygiene or what have you prior to going to bed. Think of 3 good things that happened during the day. And I know for me, those 3 good things are going to include having this amazing breakfast with my friend Nicole up on the 21st floor, looking at the beautiful city of Montreal, being here with you today, and being able to share this session with Suresh and Jeff, and having all of you here. I think there's an energy in this room. It's great. So those will be 2 out of my 3 good things. I happen to squeeze a workout in before this in the wellness center downstairs. So I've got 3 good things at least already. So no matter how bad things go, missing my flight this afternoon back to Boston or what have you, I'll be still grateful for the 3 good things. The idea is just that doing something that simple every night makes people happier. They take the follow-up quality of life surveys and they score much less burnt out and much happier. So we can use our intention to become happier and more present. Non-judgment, I'll just say, things do not have to be good or bad. They just are. So again, let's accept things as they are. And I've been a very judgmental person. I'm very fortunate. I have a lot of gratitude. I'm a professor at Stanford. I have a home on campus. I ride my bike to work. It's a great medical center. That's part of my gratitude meditation every morning. I ride my bicycle through this narrow lane. It's got a beautiful canopy of trees above. And inevitably, there'll be somebody walking in the same direction that I'm riding. And as I get closer to them, I'll notice, well, gee, they're a little wide. And they're walking right in the middle of the path. And as I get closer, I see they got buds in their ears and they're on their screen. And so I'm immediately starting to make these judgments. This person doesn't have a clue, and they're in my way, they're not being considerate, and I catch myself. Because part of my intention for that day was to be non-judgmental of the first person I met. It's a very simple exercise. So as I ride my bike past that person, we look at each other, they smile, I smile. It was a really pleasant experience. So there's that little hit of dopamine reinforcing the practice of non-judgment. Gratitude, acceptance, intention, and non-judgment. So with your permission, we have a few minutes. I'd like to do a 3-minute GAIN meditation. Next year, I hope that I'll have my book out. I wrote a book called Gain Without Pain, The Happiness Handbook for Physicians. And the purpose of the book is to emphasize these principles and try to bring it into our daily lives. So let's just, if you wouldn't mind, bear with me. I'm going to have you focus on your breath at first. And when you're breathing in, sort of do that to a slow count of 3, and then hold for 2 seconds, and then let it out effortlessly to a count of 4. So in to a count of 3, hold for 2, out to a count of 4. And we'll walk through this GAIN method. So just close your eyes and begin noticing the breath. In to a count of 3, holding for a count of 2, out to a count of 4. You notice that you can slow your breath down. noticing the beauty of the breath. So effortless. There's a vague sense of sweetness in the air that we notice when we inhale. And as we exhale, we can just feel the stress leaving our bodies, from the top of our heads to the bottoms of our feet. Noticing how grateful we are, how fortunate we are to be physicians, practicing anesthesiology, pain, intensive care medicine. How fortunate we are to be here with this wonderful group of people, our friends. We're all alike, we're all the same. How fortunate we are to be here in Montreal. What a beautiful city. How fortunate we are to have our health, our wealth, the love we share with our family, with our friends, and the privilege again to serve as physicians, as healers. Noticing our gratitude. And noticing too that there's pain and suffering in the world. We feel the pain over the centuries, our brothers and sisters who were enslaved, thrown into ship holds and sent to faraway lands where they were treated very poorly. We still feel that resonance of pain today. We feel the pain of the impact on the world's ecology. We feel the pain of families being separated at the southern border of the US. We all have our own pain. Everybody's got something. Noticing that we can open our hearts to this pain and just drop all resistance, let it in, consume it. It is part of us. It is part of all of us, equally. Noticing too the power that we have with our intention, the magic that we can decide to be happier, to be more present, to enjoy each other's company. We can use our intention to think of 3 good things at the end of the day, realizing how fortunate we are to have such wonders and wonderful things in our lives by using our intention to rewire our brains gradually, baby steps, a little bit at a time. And our gratitude, acceptance, intention on the breath, noticing our non-judgment. The world does not have to be good or bad, big or small, high or low. It just is as it is. We did not create it. We cannot fix it. We can open our minds and our hearts and accept it without any judgment. And we have our gratitude, our acceptance, our intention, and our non-judgment. And we notice these coming into our bodies with the breath and slowly relaxing. And as we begin to open our eyes, we cherish this gratitude we feel, the acceptance, intention, and non-judgment. And we find that we're in this present moment together. What a powerful field we have here with this presence right now. And we take a nice deep breath in and just slowly open our eyes. And I will stop there and thank you all very much for being present with us. We do have some time for comments, questions, criticisms, the 3 C's, as I tell my residents.
Hi. I did a scan of the room before, and I think Andy Rosenberg is not here anymore, and I were the only chairs. Is there any other academic chairs here?
Up front.
Okay. So 2 other academic chairs, which I think speaks tons to this, because if we live in organizations and we have to have, as you said, we have to have commitment of the organization and to drive the change. So I do think, as a comment, I think it's a shame there's not academic chairs here. I took my second academic job 3.5 years ago and walked into an organization, and this is a validation of the comments that have been made here this morning, an organization that was in a state of entropy. Engagement scores were in the 15th percentile nationally. People were jumping off the ship like lemmings jumping off a cliff. Our residency was in a poor situation. And I have no magical skills, but I adopted these principles of openness, of engagement, of collective leadership. And just to say to the audience, our engagement scores went from the 15th to the 85th to the 92nd percentile in 3 years. Our profitability increased. We have a wellness program. Lara Zadel's over here, who's my inspiration. So we have a wellness program. We have time off for family events, and et cetera, et cetera. And it works. It's not pie in the sky stuff that these guys have been talking about. So I just wanted to come up and say, as a chair, it works. And thank you for spreading the word. That's all.
Thank you. We'll have to have you on the panel next year.
There was a theme in your presentations about when do you accept the world as it is and when do you go out and try to change it. And my question for you is, what would you have done if the person with the ear pods in had not moved, or if you couldn't get past them, what would you have done then? And would you still have smiled at each other?
I could always get past him. Just, I might have to have a little leaf hit me in the face, but no, there's always a way past. So I would accept that they were clueless and they didn't get it, but I wouldn't judge that as being good or bad, because that could have been me on any given day. I mean, we judge people who are crossing the street while they're looking at their screens, and then the next week we just got a text, I'm on call, I'm looking at my screen and I'm crossing the street. So I think I would just remind myself to just drop the judgment. My non-judgment doesn't depend on the other person's cooperation.
I would extrapolate that to thinking about that as your C-suite too, because they are sometimes just that. And instead of being judgmental, sometimes playing with them in the sandbox sometimes does help. And Jeff has done that. I call Jeff every so often and get his advice when I have to deal with difficult situations. And a lot of times, people are still people. At the end of the day, you sit down and talk to them, they are much more willing to listen to you as opposed to saying, this is an adversarial role that I have because the C-suite is not aligned to what I'm thinking of. No, they're not. They want us to do the best. So I just wanted to use that as an opportunity to think about this differently.
Vijay Kurup from Yale. Thank you very much. This outstanding, each of these talks. And I really like this idea of presence practice. And many times people feel like in this busy lives we have no time to do this. One of the things I've incorporated into my own practice is right at the beginning of every case, everybody's standing around, we do the timeout. And then we all have our own spiel of what we say, to let the patients go gently off to sleep. And while I do that, I include everybody else who's already standing around and I say, everybody take a deep breath, because we're telling the patients, take a deep breath. So that gives us 3 minutes of presence practice for every induction we do. So just something to keep in mind. And people laugh at first and, then they all join in. The nurses are very happy because they're all running around, and then we start off, it's a 7:30 start, it's a 30-minute turnover. So everybody's running around, and gives us 3 minutes at that time for everybody just to take a deep breath, and 3 minutes, just focus on what we're doing at that minute.
That's a brilliant idea.
Yeah, thank you.
Actually, I would submit that it takes 15 seconds. I mean, I'm not sure that all of the surgeons would want to stand there for 15 minutes, or 3 minutes rather, but you can just say, agree with the timeout, yes, and everyone take a deep breath, and just let's be reminded of how fortunate we are, and let's just be grateful for each other, et cetera. I mean, it almost takes no time. That's the thing about small bites or baby steps. Pretty soon it's a steady diet. It's just part of, just as you do your hygiene in the bathroom in the morning, it's just part of the way you think.
Hi, my name is David. I'm from Rutgers, and I'm actually one of the upcoming third-year residents. And great talk, and it's something that I don't experience yet, and I hope that I don't ever in the future, but something from the resident's perspective, and I don't know how other people feel, but we see it, almost a disillusionment of medicine and what we thought it was going to be when we started and what it's turned into, or what we've, went in thinking we were going to be treating patients, we were going to be doing all these things, and not that we don't, but when you feel like you're not dragged down, but all the paperwork, all the bureaucracy of everything that goes on, it almost feels like it's a job and not a calling anymore, or not like your purpose anymore. And food for thought or comments.
That's an interesting statement. I was just speaking at a major institution last Wednesday, and the day before my talk, they asked me to meet with their senior residents and fellows. And they said, can you just have a conversation with them about career development? And I started off the thing by talking about the difference between a job, a career, and what you just alluded to, a vocation. A vocation which, in other terms, could be a calling. We're in a big transition in healthcare in this country. Way different than other countries who've acclimated to a different standard, a different level. We're in a transition that's occurring very rapidly. And so most of us don't, I'm too old to matter, and I mean it sincerely, but many in the middle, they don't know where this is going from day to day. And that unknown aspect of it makes it very hard when you're training people to tell them where they're going to go. And that's why it's so important that, we put our feet in front of each other every day. We do the things we heard about because we don't have all the answers yet. You have to believe healthcare is an essential to good being. Two, you got to believe what you're doing is a good thing. Irrespective of all the nuances and regulations around us, what we do, nobody should feel bad about what we do as professionals. And I don't mean just anesthesiologists, caregivers. It's the greatest thing in the world. You can feel good about it. You've accomplished things. You can sense reality beyond a dollar. And to cure that problem, I think you just have to want to be better than whatever you're seeing. And what you do as you go through I always say the cream rises to the top. No matter how bad it gets, good people seem to succeed at whatever endeavor they do. So I understand the plight. I don't have the cure.
So
I would
I just want to say, hey, Jeff, you do matter. We just did a large survey of all the physicians in the hospital, and primarily looking at wellness, and they exactly alluded to what you were saying. You didn't come into medicine to do all of the other scut work that you're trying to do. And in fact, when you look at medicine, specialties in medicine as well as in surgery, they spent more time because of the EHR and all the stuff that they had to populate than taking care of patients. And this is a frustration for trainees, because you're saying, hey, wait a second, I'm supposed to be learning here. I'm supposed to be doing different things. This is not why I went to medical school. And this is, again, part of what we in leadership need to start doing, is try to funnel off some of this work. We've automated a lot of stuff. My younger days, I had to chart each and every blood pressure. Can you imagine doing that?
We still do that.
I would just say to you that, as I tell our trainees,
I'll be okay.
go back to the GAIN principles. You're in a great place, you're getting great training, you're very privileged. Be grateful. Accept those things in medicine that you're being exposed to that you can't change, and also accept the fact that there's a lot of whiners out there. Use your intention to be face forward, present, happy. You can do that. And then don't judge the other people and the processes around you. Just focus on being present, and I think that things will be very different. It's all a matter of perspective.
Sure.
But thank you for speaking up.
I'm going to add one thing to Greg's, because he said, accept what you can't change. That's different than acceptance. I believe we should all have a commitment to a better way, which is different. If we're blatantly accepting of whatever, you'll never get where you need to be, all right? And two, recognize, as I said, every organization's different. Southwest Airlines for years has the best customer satisfaction and the most profitability of any airline. The flight attendants help clean the plane. They joke with the customers. They don't have all the other rigmarole. You get on the more expensive ones, and you look at the people working there, and they're angry to be there because they know how they're treated. So going back to the changes that you're going through, those are outside. What's important is what's inside at Rutgers. Do you feel you're cared about? We can't control that outside. Leaders need to. You're not at a stage to do that.
No.
You just need a commitment to a better way.
Thank you.
Hi. I just wanted to get an opinion from the audience. I might say something that is completely, will not be accepted. But since our specialty and all the medicine specialty is moving from being private more and more towards being hospital employed, the nursing have their unions, and I know the word union is a horrible word for a lot of us, but isn't there a need for physician unions, the ones that would protect something that is important to us, that we stand for?
I'll let these guys go because I'd be too opinionated to answer it. I'll let them go first.
Well, I think she wants an opinionated view now, Jeff.
Okay. Bottom line is, I think if we get to that day could come that we have to become unionized, and we will hit the bottom. At that point, we will hit the bottom of what a professional is, okay, and what differentiates us. Again, remember, I'm cynical. I think our leadership's pathetic. If we don't have good leadership, we will go to the bottom of anything, a country, a city, a state, or our practice. If we don't have the leadership, we'll have to go that route, because then we'll be fundamentally flawed and we'll have to fight through other means.
But we are the leadership, though.
Huh?
Right.
We are the leadership. We can choose who our leaders are, and we can choose which direction to go.
Well, that's important. I don't know if we do choose our leaders. That's interesting.
So on the heels of what he said,
Professional societies should
Yeah.
do that job, like the ASA and your IRS.
Yeah, I agree with you.
That would be the duty, but I never see really. ASA is somehow, I'm a little bit critical there, but they are really selling out things.
Well,
somehow.
So, Kristen,
she's going to be a great leader.
Christian, what happens across the pond? Do you guys have physicians who are, you obviously, your society, German society, do you have any help from them to make things
I just
better?
decided to look into it in Germany. It's not a big issue, and I just decided, inspired by your talk, that we have to bring it to our country too. We are not so stressed out. We are not allowed to work more than 48 hours a week and these things. So after 10 hours, we have to work to stop, and we have to have 11 hours in between then before we are allowed to work again. So these things are much, much better and easier. But there's still a lot of burnout, because there is not only the working load, it's thousands of other things. And so I just decided that I have to bring it to my society in my country.
Yeah.
Maybe one more comment in the back.
Yes.
Thank you very much. I'm John Ellis. This is a question, well, first a statement. My friend Eric Jacobson, who was chair at Winnipeg, told me that his faculty anesthesiologists were unionized. So there may be an experience here north of our border. That's number one. But my question is about our leaders, if they are so crucial to developing culture, are they selected, or are they based on innate characteristics, or can they be developed? Are the Navy SEALs resilient because they receive support, or because Navy SEALs are people who are innately resilient and are therefore selected?
Both.
How do we select our leaders?
I think that's a great point, John, and I think the SEALs, the initial part is a selection process, no different than going to med school. We know when you go to med school, it's kind of like you've got an adequate level of IQ. We know that, so that's part of the selection process. What we fail on, think about how we get our leaders in organized medicine. Look at all the academic institutions in the U.S. I can't speak about Germany or elsewhere, but they have very thick CVs. They often have significant research money, NIH particular if you're going to an esteemed institution, and many institutions want to pick their leader from outside, from another institution. When you pick a leader from the outside, you're right away saying this department is not particularly good. That's why Coca-Cola has never had an outside CEO. Disney has never had an outside CEO. When you have disruption or need for disruption, you need an outsider. When you have excellence in all I'll tell you is, folks, is look at Mayo Clinic. I'm not saying they're the best healthcare, but they don't bring leaders in from the outside. To run Mayo Clinic, to be a chairman at Mayo Clinic, you're there. They hire from the outside, they promote from the inside, because their culture is stronger than the individual. The rest of us, we're floundering. We're floundering in how we do things. But what you said is right. I think it's a combination of selection, appropriate, and then, training and other things.
Thank you.
Thank you all very much for attending, and it's been wonderful.
Such an argument.